In the other videos, you've already learned quite a bit about what exactly radiation therapy is and how it works. Now we're going to talk about the do's and don'ts that you as parents or affected teenagers should keep in mind to ensure the treatment goes as smoothly and complication-free as possible. In fact, there is a lot you can do to support the therapy and help prevent side effects. I've divided this into 3 main topics here: taking medication, skin care, oral care. And I'd say, let's not beat around the bush and get straight to the point. So let's start with taking medication. It's extremely important that you inform your treatment team exactly which medications you or your child are currently taking. This includes all medications that have been prescribed to you or your child by a doctor, but of course also those that you have bought yourself at the pharmacy. Medications can interact with radiation therapy and affect the effectiveness of the treatment. That's why you simply have to talk about it. And be careful, this also applies to dietary supplements and alternative medicine products, such as vitamin C, vitamin E, plant-based substances like carotenoids, flavonoids, or even the trace element selenium. No matter what it's about, just tell the people at the clinic. Always let them know so that unwanted interactions don't occur. That's why I have prepared a little warning sign for you. It tells you should discuss any medication with your nurses and doctors. By the way, you don't need to worry that your doctors might react angrily just because you're thinking about taking something extra. After all, it's completely normal that you want to do everything you can to support the healing process. But the people at the clinic also want to ensure you get the best possible treatment. And that only works if you work together and are completely open and honest with each other. So now, let's move on to the next important point: skincare. When radiation enters the body, the very first thing it hits is the skin. As a result, it becomes very sensitive, comparable to when it becomes sunburned. And for this reason, you or your loved one should also avoid anything that could further irritate the affected areas of skin. That means not wearing clothes that scratch, chafe, or cut into the skin, but instead choosing loose clothing made from soft, natural fabrics like cotton, for example. Also, it's best to wash only with water and very mild soap. Also, don't bathe or shower for too long or with water that's too hot, until your skin gets all wrinkly and soft. If the radiation is on the head, in this case your hair should only be washed with a mild baby shampoo, and when drying off, always gently pat the area, don't rub. And also very important, do not wash off the markings that may be somewhere on your skin, which were drawn on for the radiation treatment. They are still needed. If you want to take care of your skin, it's best to use a watery lotion or lotion and not greasy creams. If you're unsure, just ask at the radiation clinic before using the product for the first time to make sure it's okay. It's also important that you don't apply skincare products right before or right after the radiation treatment, but wait at least 2 hours. Also, stay out of the sun, so keep all body parts that have been irradiated covered no matter what the weather is like outside. For example, wear a cap if your head was irradiated. And also avoid anything else involving intense heat, but also cold. Your skin really can't tolerate that right now. So it's better to avoid hot water bottles or ice packs for now. Going to the swimming pool or outdoor pool isn't a good idea at the moment either, because your sensitive skin can be further irritated there by sun, chlorine, or other factors. Alright, now let's move on to the last important point of this video. That is oral care. Because radiation doesn't just affect the skin on the outside, but also on the inside, meaning the mucous membranes. This is especially true with radiation to the head or neck, which can lead to inflammation in the mouth area. It's also quite possible that your mouth will become very dry because less saliva is produced. This makes it much easier for bacteria to thrive. So always brush your teeth well and rinse your mouth thoroughly several times a day. There are special mouthwashes for this purpose. But you can also gargle quite well with mild tea, for example, sage tea. For younger children who can't use mouthwash yet, moist swabs can also help. Also, use a soft toothbrush and a toothpaste that isn't too strong. Okay, but what should you do? If a sore spot does develop, it's important to keep brushing anyway so it doesn't get worse. It's also best to ask at the clinic what to do in that case and which products can help now. And of course, it's also clear that you should avoid eating foods that are acidic, spicy, or very strongly seasoned. So it's better to skip the currywurst with the chili turbo sauce 3000. So with all these measures we have explained here, you can help reduce or even completely prevent unwanted side effects of radiation therapy. And if you want to learn even more about possible side effects of radiation and what you can do about them, then check out the next video on the side effects of radiation therapy.